The medical bay doors opened with a soft hiss. Two emergency staff rushed through, pushing a floating stretcher between them. On it lay a human male, unconscious and covered in blood. Nurse Veltara looked up from her workstation, her 4 eyes focusing on the new patient. She had never treated a human before. "Trauma from pirate raid," one of the emergency staff said quickly. "Multiple injuries, broken bones, internal bleeding." Veltara moved to the stretcher on her 6 legs. Her insectoid body was perfectly designed for medical work. Her thin fingers could perform delicate procedures. Her multiple eyes could see details others missed. She had been working on this hospital ship for 12 years. She had seen injuries from hundreds of different species, but humans were new to the Galactic Union. Their medical files were still incomplete. The human's name was Deho. He was a cargo pilot. His ship had been attacked near the border zone. He had fought back, which explained his injuries. Veltara scanned his body with her medical device. The readings made her mandibles click with concern. 3 broken ribs, a punctured lung, deep cuts across his arms and chest, internal bleeding in his abdomen. For most species, these injuries would be critical but treatable. She began working immediately. Dr. Thexil arrived within minutes. The senior physician was a Kresh, an amphibian-like species known for their medical expertise. His wet skin glistened under the medical bay lights. He examined the scans that Veltara had already taken. "Stabilize the internal bleeding first," Dr. Thexil said in his gurgling voice. "Then we repair the lung. The broken ribs will heal on their own with proper support." Veltara nodded. She had already prepared the surgical area. The procedure took 3 hours. Deho's biology was similar enough to other mammals that the standard techniques worked. His blood was red, like several other species. His organs were arranged logically. Nothing seemed too unusual. When the surgery finished, Veltara moved Deho to a recovery pod. The pod would monitor his vital signs and alert her to any changes. She updated his medical file with notes about the surgery. Then she returned to her other patients. The hospital ship held over 200 beings from across the galaxy. Veltara was responsible for 50 of them. She checked on a Quilix trader recovering from radiation poisoning. She changed bandages on a Sauric security officer who had been burned in an engine fire. She administered medicine to a Vreen child with a respiratory infection. Hours later, she returned to check on Deho. He was still unconscious, but his vital signs were stable. The monitors showed his heart beating steadily. His breathing was regular, assisted by the medical equipment. Everything looked normal. 48 hours passed. Veltara checked on Deho every few hours. His body was responding to treatment as expected. The internal bleeding had stopped. His lung was inflating properly. The broken ribs were beginning to knit together. For a mammalian species, his recovery was progressing well. On the 3rd morning, Veltara noticed something strange. Deho's temperature had increased, not by much, but it was higher than it had been. She checked the monitors more carefully. His heart rate had also increased slightly. Blood flow to his injury sites was much higher than before. She examined the wounds on his arms and chest. They looked different. The tissue around each cut was swollen. The skin was red and hot to the touch. Veltara's eyes widened. This was inflammation. In every species she had ever treated, inflammation was a sign of serious infection or tissue rejection. She ran more scans. The swelling was spreading. The temperature at the injury sites was even higher than his core body temperature. His white blood cell count had increased dramatically. All the signs pointed to the same conclusion. His body was rejecting the surgical repairs. An infection was taking hold. Veltara immediately called Dr. Thexil. The senior physician arrived quickly, his throat sac inflating with concern when he saw the readings. "This is bad," Dr. Thexil said. "His immune system is attacking the healing tissue. If we don't stop this inflammation, it will spread throughout his body. He could go into septic shock. Should we prepare the anti-inflammatory treatments? Veltara asked. Yes, immediately. Use the broad-spectrum protocol. It works on 47 different species. It should work on humans, too. Veltara rushed to prepare the medication. Her hands moved quickly, mixing the precise amounts needed for Daeho's body weight. This medication was powerful. It would suppress his immune system and stop the dangerous inflammation. It had saved countless lives across the galaxy. As she worked, Daeho began to wake up. His eyes opened slowly. He looked around the medical bay with confusion. When he tried to sit up, pain stopped him. He groaned softly. Veltara approached his bed. Her translator device activated automatically. "Please remain still," she said. "You were injured. You are in the hospital ship medical bay." Daeho looked at her. His eyes took in her insectoid features without fear. He had probably seen many alien species during his work as a cargo pilot. "How bad is it?" he asked. His voice was rough from sleep. "You had surgery 2 days ago," Veltara explained. "The surgery was successful, but now you have developed a serious inflammation. We are preparing medication to treat it." Daeho frowned. He looked down at his bandaged arms. "Inflammation? That's normal, though, isn't it?" Veltara's mandibles clicked in confusion. "Normal? No, inflammation is a sign of infection or tissue rejection. It is very dangerous, but do not worry. Our medication will stop it." "Wait," Daeho said. He tried to sit up again, wincing at the pain. "I feel fine. Actually, I feel better than I did yesterday. The pain is less." Veltara checked her scanner. He was right. Despite the inflammation, his pain responses were lower than before. But that didn't make sense. Inflammation should cause more pain, not less. Unless the inflammation was so severe, it was damaging his nerves. "You may not feel the full extent of the damage," Veltara said gently, "but the scans do not lie. Your body is experiencing a dangerous immune response. We must treat it immediately." Daeho opened his mouth to respond, but Dr. Thexil arrived with the medication. The senior physician's large eyes examined the human with concern. "We are going to administer this through your IV line," Dr. Thexil explained. "You may feel drowsy. The medication will suppress your immune system and reduce the inflammation. It will take several hours to work fully." "I really don't think this is necessary," Daeho said. "Inflammation is part of healing for humans. We're supposed to swell up a bit." Veltara and Dr. Thexil exchanged glances. The human was clearly confused, probably from the trauma of his injuries. No species was supposed to develop inflammation. That went against all known medical science. "Please trust us," Veltara said softly. "We have treated thousands of patients from hundreds of worlds. We know what we are doing." Daeho sighed, but didn't argue further. He settled back onto his bed. Dr. Thexil connected the medication to the IV line. The clear liquid began flowing into Daeho's veins. Veltara watched the monitors carefully. She expected to see the inflammation markers begin to drop within an hour. She expected Daeho's temperature to return to normal. She expected his white blood cell count to decrease. But as she stood there, watching the human close his eyes and drift into medicated sleep, she felt something unusual, a feeling she rarely experienced in her work. Uncertainty. Something about this situation felt wrong, but she pushed the feeling aside. She was a professional. She trusted the science. She trusted the protocols that had worked across the entire galaxy. The medication would work. It had to work. 6 hours after the medication began flowing into Daeho's veins, everything went wrong. Veltara was checking on another patient when the alert sounded. The high-pitched alarm meant critical vital signs. She rushed back to Daeho's recovery pod, her 6 legs moving faster than usual. The monitors showed chaos. Daeho's temperature had spiked even higher. His heart rate was racing. His breathing was shallow and rapid. The inflammation markers hadn't decreased at all. Instead, they had gotten worse. Much worse. Dr. Thexel arrived moments later. His throat sac deflated in shock when he saw the readings. "This doesn't make sense," he muttered. "The medication should be working by now." Daeho was awake but looked terrible. His skin was pale and covered in sweat. He was shivering despite the fever. When he spoke, his voice was weak. "Something's wrong. I feel worse than before. Much worse." Veltara checked the medication levels. Everything was correct. The dosage was appropriate for his body weight. The delivery system was working properly, but somehow the treatment was making him sicker instead of better. "Increase the anti-inflammatory medication," Dr. Thexel ordered. "Double the dose. We need to suppress this immune response before it kills him." Veltara moved to adjust the medication, but Daeho grabbed her arm weakly. "No, please. Something's wrong with the medicine. I could feel it. Stop giving it to me." "The medication is safe," Dr. Thexel said firmly. "It has been tested on 47 species. Your body is simply fighting the treatment. This sometimes happens with severe inflammation. We must push through it." Before they could administer more medication, the medical bay doors opened again. A young human woman rushed in. She was dressed in the uniform of the diplomatic corps. Her eyes immediately found Daeho on the bed. "What's happening?" she demanded. "I'm Hei-Wan, assistant to the human ambassador. I was told one of our pilots was in critical condition." "We are treating a severe inflammatory response," Dr. Thexel explained. "His body is rejecting the surgical repairs. We are administering standard anti-inflammatory medication." Hei-Wan's eyes went wide. She looked at the monitors, then at the IV line, then back at Dr. Thexel. "You're doing what? You're suppressing his immune response?" "Of course," Veltara said. "The inflammation is dangerous. It could lead to septic shock." "Oh, no! No, no, no!" Hei-Wan moved to the IV line and reached for it. "You need to stop this medication immediately. Right now." Dr. Thexel stepped forward, blocking her. "I cannot let you interfere with medical treatment. This patient is under our care." "And you're killing him." Hei-Wan's voice rose. "Human inflammation isn't like yours. It's not a sign of failure. It's how we heal. You're stopping his body from repairing itself." Veltara felt her mandibles click in confusion. "That's impossible. Inflammation causes tissue damage. It spreads infection throughout the body. Every species we know follows this pattern." "Well, humans don't," Hei-Wan said urgently. "When we get injured, our blood vessels expand around the wound. That causes swelling and heat. Our white blood cells flood into the area. They attack bacteria and dead tissue. They release chemicals that help rebuild damaged cells. This is normal. This is necessary. If you suppress it, you stop the healing process." Dr. Thexel's throat sac pulsed slowly. This was a sign of deep thought in his species. "You're saying that human bodies deliberately cause inflammation? That it's a controlled response, not a system failure?" "Yes, exactly." Hei-Wan looked relieved. "Has no one read the human medical database entries? We submitted them when we joined the Galactic Union." Veltara checked her computer terminal. She searched for human medical files. They were there, but marked as incomplete and preliminary. Most medical staff hadn't studied them in detail yet. Humans were too new. There hadn't been time to fully integrate their biological information. She started reading the files now. Her eyes widened with each paragraph. Everything Hei-Wan was saying was documented. Human inflammation was described as an adaptive immune response and a critical component of healing. The files even included warnings not to suppress it unless absolutely necessary. "I didn't know," Veltara said quietly. "We treated him according to standard protocols. We thought we were saving his life." "You need to disconnect that medication now," Haywan insisted. His body is trying to heal, and you're poisoning him by stopping it. Dr. Thexil considered for a long moment. Then he nodded. Disconnect the IV. We'll monitor him closely. If his condition worsens, we'll need to reconsider. Veltara carefully removed the IV line from Deho's arm. The human let out a long breath of relief. "Thank you," he whispered. "I'm so sorry," Veltara said. "We should have consulted the human medical files more carefully." Haywan's expression softened. "You didn't know. But from now on, if you see inflammation in a human patient, that's usually a good sign. It means we're healing. If you don't see inflammation when there's a serious injury, that's when you should worry." The concept made Veltara's head hurt. It went against everything she had learned in medical school. For her entire career, she had fought inflammation. She had seen it as the enemy. But for humans, it was a tool, a weapon their bodies used to fight injury and infection. Over the next 24 hours, Veltara watched Deho carefully. Without the anti-inflammatory medication, his body resumed its natural processes. The fever continued for a while, then gradually decreased. The swelling around his wounds remained high, but didn't spread to the rest of his body. His white blood cell count stayed elevated. And then, something remarkable happened. Deho started healing faster. Much faster than any mammalian species Veltara had ever treated. His broken ribs were forming new bone at an incredible rate. The scans showed calcium deposits already strengthening the fracture sites. This should have taken weeks. It was happening in days. The cuts on his arms and chest were closing. New tissue was forming underneath the scabs. The inflammation around each wound was gradually decreasing as the healing progressed. It was as if the swelling had a purpose, and once that purpose was fulfilled, it naturally went away. Dr. Thexil came to observe several times a day. He was as fascinated as Veltara. "I've never seen anything like this," he admitted. "His body is coordinating multiple healing processes simultaneously. The inflammation acts like a signal, directing resources to where they're needed most." Commander Zix, the station security officer, also stopped by. The tall Saurix had scales that changed color with his mood. Currently, they were showing curiosity. "I heard you almost killed a human by making him healthy," he said, with what might have been humor. "It was a misunderstanding," Veltara replied, still embarrassed. "We didn't understand how different human healing is." "Different is an understatement," Commander Zix said. "I've been reading the reports. Humans deliberately damage their own tissue to make it stronger. They call it exercise. They inflame their muscles on purpose." Veltara had read the same reports. The more she learned about human biology, the more amazed she became. Humans could adapt to almost any environment. They could survive injuries that would kill most species. They healed through what others would call damage. On the second day after stopping the medication, Deho was sitting up in bed. He was eating solid food. He was talking with Haywan about when he could return to work. His wounds were still visible, still inflamed, but clearly healing. The redness around each injury was already fading. Veltara approached his bed with her scanner. "How do you feel?" she asked. "Much better," Deho said with a smile. "A bit sore, but that's normal. The inflammation is doing its job." "I want to apologize again," Veltara said. "We should have been more careful. We should have consulted with human medical experts before treating you." "You were trying to help," Deho said. "You used the best knowledge you had. That's all anyone can do. Now you know better for next time." Veltara's mandibles clicked in what might have been gratitude. "Yes, now we know, and I promise I will study human medicine thoroughly. This will not happen again." She meant it. That night, after her shift ended, Veltara stayed in the medical bay. She read every file on human biology she could find. She studied their immune system, their inflammatory responses, their healing processes. Each page revealed something that contradicted what she thought she knew about medicine. Humans were extraordinary, and Veltara was determined to understand them. Word spread quickly through the hospital ship. Within a day, everyone knew about the human patient who healed through inflammation. Medical staff from different departments found excuses to walk past Daeho's recovery pod. They wanted to see this strange biology for themselves. Dr. Thexil decided they needed expert help. He called Dr. Bo Ra, a human xenobiologist who worked in the research wing of the station. She arrived the next morning carrying several data tablets and a bag that smelled unusual. "I heard you tried to cure a human of healing," Bo Ra said as she entered the medical bay. She was smiling, which Veltara had learned meant humans found something amusing rather than threatening. "We made a mistake," Dr. Thexil admitted. "We're hoping you can help us understand human physiology better before we make another mistake." Bo-Ra set down her bag and pulled out one of her data tablets. "Human healing is complicated. Let me show you some comparisons." She projected images into the air above her tablet. The first showed a cross-section of human tissue after an injury. Veltara could see the blood vessels dilating, the fluid accumulating, the white blood cells swarming the area. "This is inflammation," Bo-Ra explained. "For most species, this would be a sign that something went wrong. But for humans, this is the first stage of healing. Our body floods the injury with resources. Blood brings oxygen and nutrients. White blood cells attack any bacteria that got in through the wound. They also clean up damaged tissue." The next image showed the chemical signals involved in inflammation. Veltara counted dozens of different molecules. Each one had a specific job. Some called white blood cells to the area. Others triggered pain responses. Others started the repair process. "We don't just inflame randomly," Bo-Ra continued. "Our bodies control every aspect of it. The inflammation is strongest in the first few days, then gradually decreases as healing progresses. If we stop this process, the wound would never heal properly." Dr. Thexil's throat sac pulsed thoughtfully. "So when we gave Daeho anti-inflammatory medication, we stopped his body from healing itself?" "Exactly. His immune system was trying to repair the damage, and you told it to stop. That's why he got worse instead of better." Veltara felt another wave of shame. They had hurt their patient while trying to help him. It was every medical professional's worst fear. "There's more," Bo-Ra said. She pulled up another image. "Humans can trigger inflammation deliberately. We do it all the time." "Haywan mentioned exercise," Veltara said, "but I didn't fully understand. When humans exercise, we damage our muscle tissue on purpose. Tiny tears form in the muscle fibers. This triggers inflammation. Our body repairs the damage and makes the muscle stronger than before. We call it adaptation." The medical staff gathered around stood in silence. The concept was difficult to accept. Deliberate self-damage to become stronger? It sounded like madness. "We also eat things that cause inflammation," Bo-Ra said casually. She reached into her bag and pulled out a small container. "Like these." She opened the container. Inside were dried red peppers. The smell made several of the alien medical staff step back. Veltara's sensors detected capsaicin, a chemical that triggered pain responses in most species. "These are spicy peppers," Bo-Ra explained. "They contain a chemical that makes our bodies think they're under attack. Our mouth tissues inflame, we sweat, our heart rate increases, and many humans enjoy this feeling." "You eat pain on purpose?" Veltara asked. Her mandibles clicked rapidly in confusion. "Some of us do. Some humans love spicy food. Others prefer mild flavors. But the point is, our bodies can handle the inflammation. We've evolved to use it as a tool, not fear it as a threat." At that moment, the medical bay doors opened. A cargo worker entered carrying a thermal container. It was Quan Sik, Daeho's co-pilot. He was also human, tall and broad-shouldered with a friendly face. "I brought lunch for Daeho," Quan-Sik said. "The station's human quarter makes real food. Hospital food is terrible." He walked to Daeho's bed and opened the container. Steam rose from inside, carrying the smell of spices and cooked noodles. Veltara's scanners immediately detected high levels of capsaicin. "You brought me the spicy noodles," Daeho said happily. "You're the best." "Wait," Veltara said, moving forward. "Those are inflammatory. You're still healing. You shouldn't eat anything that triggers an immune response." Both humans looked at her with confusion. Then Quan-Sik started laughing. "The noodles won't hurt him. Spicy food doesn't actually damage tissue. It just feels like it does. The inflammation is temporary and harmless." "But our scanners will detect it," Dr. Thexel said. "It will look like he's getting worse." "Then maybe turn off the scanners during lunch," Daeho suggested. He was already picking up the chopsticks from the container. "I've been eating hospital nutrition paste for 3 days. I need real food." Veltara looked at Bo-Ra for guidance. The xenobiologist shrugged. "It won't harm him? Humans eat spicy food all the time, even when injured. The capsaicin might even help with pain management. Some humans say it releases endorphins." Against her better judgment, Veltara stepped back. She kept her scanners active, though. She wanted to see what happened when a human deliberately inflamed their own body. Daeho took his first bite of noodles. Within seconds, his skin began to flush. Sweat formed on his forehead. His breathing quickened. The scanner showed his mouth and throat tissues reacting to the capsaicin. Blood flow increased. Temperature rose. Every indicator showed a chemical attack in progress. And Daeho was smiling. He took another bite, then another. "So good," he said between mouthfuls. "You got them extra spicy, didn't you?" "Of course," Quan-Sik said. "You need something to make you feel alive after being stuck in a medical bed." Veltara watched in fascination. The inflammation in Daeho's mouth was significant. It would cause severe pain in most species. Some might even lose consciousness from the shock. But Daeho was enjoying it. His body was under attack, and he was happy about it. "This is insane," one of the other nurses whispered. She was a Quillix, a species with very sensitive tissue. The thought of deliberately inflaming any part of her body made her shudder. "This is normal for humans," Bo-Ra said. She was recording the scanner data on her tablet. "We have a complex relationship with pain and inflammation. Sometimes we avoid it. Sometimes we seek it out. Our bodies are resilient enough to handle both." Over the next 20 minutes, Daeho finished his meal. The inflammation in his mouth gradually decreased. His body temperature returned to normal. His breathing slowed. The scanners showed no lasting damage. It was as if the attack had never happened. "How do you feel?" Veltara asked. "Full and happy," Daeho replied. "Thanks for letting me eat real food." That evening, Veltara compiled a detailed report about what she had observed. She included scanner data from Daeho's entire recovery process. She added the information Bo-Ra had shared about human inflammatory responses. She attached notes about the spicy food incident. Then she sent the report to the Galactic Medical Council. She titled it, "Inflammation as Adaptive Healing Response, Observations of Human Patient Recovery." Within hours, she received responses. Medical professionals from across the galaxy wanted to know more. Some were skeptical, some were fascinated, some thought the report was a mistake or a joke, but they all agreed on one thing. Humans were different, very different. And if the medical community wanted to treat them properly, they needed to completely rethink their understanding of inflammation. Veltara looked at Daeho, who was now resting comfortably in his bed. His wounds were healing rapidly. His broken ribs were almost fully repaired. In another few days, he would be ready for discharge. All because his body knew how to heal itself. All because inflammation, the thing medical science had taught her to fear, was actually his greatest ally. She had learned more from this one human patient than from years of traditional medical training, and she knew her education was just beginning. 5 days after the spicy noodle incident, Daeho developed a fever. Veltara noticed it during her morning rounds. His temperature had climbed to 39 degrees Celsius. For most species, this would be dangerously high. For some, it would be fatal. She immediately checked the wound sites. They looked good. The inflammation was decreasing as expected. There were no signs of infection. But the fever was undeniable. The scanners confirmed it. Veltara's first instinct was to sound an alarm. A fever this high meant serious infection, but she had learned to be cautious with human patients. She contacted Bora first. The xenobiologist arrived within minutes. She examined Daeho and checked the scanner readings. Then she laughed softly. "It's just a fever. His immune system is doing its job." "Just a fever?" Veltara's mandibles clicked in distress. "His temperature is high enough to damage brain tissue in most species." "But not in humans," Bora explained. "We can safely operate at temperatures up to 40 degrees Celsius, sometimes even higher. Fevers are another tool our immune system uses. Higher temperature helps our white blood cells work better. It also makes it harder for bacteria and viruses to survive." "So we do nothing?" Dr. Thexil asked. He had come to see what the commotion was about. "We monitor him," Bora said. "If the fever goes above 40 degrees, we should intervene. Below that, it's helping more than hurting." Daeho woke up during this conversation. He looked tired and was clearly uncomfortable but not panicked. "I have a fever?" he asked. "Yes," Veltara said. 39.2 degrees. "That's not too bad," Daeho said. He closed his eyes again. "Wake me if it gets to 40. And then he went back to sleep. Just like that. As if having a potentially deadly fever was normal. As if his brain cooking inside his skull was no cause for concern. Veltara watched him sleep. She kept her scanners on him constantly. Every instinct screamed at her to do something, to cool him down, to give him medicine, to save him. But Bora had said to wait, and Bora was the expert on humans. The fever lasted for 18 hours. During that time, Daeho slept mostly. He woke occasionally to drink water. He complained about feeling hot and achy, but he never seemed worried. He treated the fever like a minor inconvenience, not a medical emergency. And then, as Bora had predicted, the fever broke. Daeho's temperature dropped back to his normal 37 degrees. He woke up feeling better. The inflammation around his wounds had decreased even more. His body had used the fever to speed up the healing process. Later that day, a new visitor arrived at the medical bay. She wore the uniform of Earth's diplomatic corps, with additional medical insignia. Her name was Young Mi, and she was a trained human medic sent to help bridge the gap between human and alien medicine. "I heard about the fever incident," Young Mi said to Dr. Thexil. "I thought it was time someone gave you a proper briefing on human physiology." She set up a presentation in the medical bay's conference room. Veltara attended along with Dr. Thexil and several other medical staff members. Young Mi's presentation was detailed and thorough. It was also deeply unsettling. "Human body temperature regulation is unique," Young Mi began. She displayed a thermal image of a human child. The temperature reading showed 40 degrees Celsius. Several of the alien medical staff gasped. "This is a 7-year-old child with a common viral infection," Young Mi continued calmly. "She had a fever of 40 degrees for 2 days. Her parents gave her fluids and rest. She recovered completely. She's now 25 years old and serves as a ship captain in the merchant fleet." The image changed to show recovery data. The child's immune system had fought off the virus. The fever had helped. There were no lasting effects. She had been completely fine. "Most species would die at this temperature," a Quillix doctor said quietly. "Their proteins would denature. Their cellular structures would break down. Human proteins are more stable, Young Mai explained. We evolved on a planet with extreme temperature variations. We needed to survive both freezing cold and burning heat. Our bodies adapted to handle internal temperature fluctuations that would kill most other species. The presentation continued. Young Mi showed data on human wound healing. She explained how scar tissue worked. This was another concept that shocked the alien medical staff. "You don't regenerate perfectly?" Dr. Thexil asked. His throat sac deflated in surprise. "The damaged tissue is replaced with inferior material?" "Scar tissue isn't inferior," Young Mi corrected. "It's different. It's stronger in some ways. It forms quickly to close wounds. It prevents infection. Yes, it's less flexible than original tissue, but it keeps us alive. And our bodies keep the scars as reinforcement. We treat them as battle damage that makes us more resistant to future injury." Veltara thought about the scars she had seen forming on Daeho's arms and chest. She had assumed they were a failure of his healing process. She had thought his body couldn't regenerate properly. But now she understood. Those scars were intentional. They were armor made from his own tissue. "I need to update our protocols," Dr. Thexil said. "We've been treating humans like any other mammalian species, but clearly, that's wrong." "Very wrong," Young Mi agreed. "Human healing follows completely different rules. What looks like danger to you is normal for us. What looks like success to you might actually be harming us." She pulled up another image. This one showed a comparison between standard galactic medical treatment and human-specific treatment for the same injury. The difference was dramatic. "If you suppress human inflammation, healing stops," Young Mi said. "If you prevent fever, you weaken the immune response. If you try to prevent scar formation, wounds stay open longer and infection risk increases. You need to let human bodies do what they evolved to do." At that moment, an alert sounded. Another emergency patient was arriving. The medical bay doors opened. Emergency staff rushed in with another human on a stretcher. This one was a Marine. His armor was damaged. He was bleeding from multiple wounds. "Combat training accident," one of the emergency staff reported. "Multiple lacerations, possible broken arm, blunt force trauma to the chest." Dr. Nexara, another physician on staff, took charge. She was a careful, by-the-book doctor who didn't like deviating from established protocols. "Prepare the surgical suite. We'll repair the damage and then monitor for inflammation." "Wait," Young Mi said quickly. "Let me examine him first." She moved to the stretcher. The injured Marine's name was Tai Yang. He was conscious and alert despite his injuries. Young Mi checked his wounds quickly and efficiently. "The cuts are clean," she said. "No major arteries damaged. The arm is fractured but not displaced. The chest trauma looks worse than it is. I recommend basic cleaning and bandaging. Let his body handle the rest." Dr. Nexara's skin darkened with disapproval. "That's not proper medical care. We need to surgically close these wounds. We need to set the bone properly. We need to prevent inflammation." "No," Young Mi said firmly. "You need to clean the wounds and step back. His immune system will take care of everything else." A disagreement erupted. Dr. Nexara insisted on following standard protocols. Young Mi insisted that standard protocols would harm the patient. Other medical staff took sides. Some agreed with the proven methods that had worked for hundreds of species. Others thought they should trust the human expert. Finally, Consul Vranik arrived. The Galactic Union official had heard about the debate. "This is becoming a serious issue," he said. "We need clear protocols for human patients. We can't have doctors arguing every time a human gets injured." "I agree," Dr. Thexil said. "I propose we observe both approaches. We have 2 human patients with similar injuries. Let Dr. Nexara treat Tai Yang with standard protocols. We'll continue allowing Daeho's natural healing. We'll compare the results." Young Mi looked unhappy. "You're experimenting on patients?" "We're documenting different treatment approaches," Dr. Thexil corrected. Both patients will receive care. We'll just use different methods. The data will help us develop proper human medical protocols. After much discussion, both patients agreed. Tai Yang would receive standard treatment. Dai Ho would continue with minimal intervention. The medical community would watch both cases carefully. Veltara felt torn. She wanted to trust the proven protocols, but she had seen how badly those protocols had failed with Dai Ho. Maybe young me was right. Maybe humans needed completely different care. Over the next few days, the difference became clear. Dai Ho continued to heal rapidly. His scars formed cleanly. His broken ribs strengthened. He was almost ready for discharge. Tai Yang's healing stalled. The surgically closed wounds weren't knitting together properly. His set bone wasn't forming new calcium deposits. And worst of all, with his inflammation suppressed, a real infection was starting. His body couldn't fight it effectively. Dr. Nexara finally admitted defeat. She stopped the anti-inflammatory medication. She allowed Tai Yang's immune system to work naturally, and immediately his healing accelerated to match Dai Ho's. The evidence was undeniable. Human healing required inflammation, required fever, required all the things that galactic medicine had been trained to prevent. Everything they knew was wrong, at least when it came to humans. The medical bay became the center of attention across the entire station. Doctors, researchers, and curious staff members found reasons to visit. Everyone wanted to see the two human patients healing side by side. It was like watching two different versions of medicine compete in real time. Veltara had set up monitoring stations between both recovery pods. She could watch Dai Ho and Tai Yang simultaneously. The comparison was striking. For the first 3 days after Tai Yang's arrival, the differences had been dramatic. Now that both patients were receiving proper human-centered care, they were healing in almost identical patterns. "Look at this," Veltara said to Bo-Ra one morning. She pulled up the scan data on her display. Their inflammation markers are synchronized. Their white blood cell counts rise and fall together. Even their tissue regeneration is happening at the same rate. Bo-Ra studied the data with interest. That's because they're both healthy humans healing from similar injuries. This is what normal looks like for us. Consistent, predictable. Once you understand the pattern. Dr. Nexara approached the monitoring station. The doctor had been quieter since admitting her mistake with Tai Yang. Her skin color kept shifting between shame and curiosity. "I've been reviewing the literature on human immune responses," she said. "The complexity is remarkable. Your bodies have backup systems for the backup systems. Redundancy is a human specialty," Bo-Ra said with a smile. "Our evolution made us survivors. If one healing system fails, 3 others kick in. We're very hard to kill." "I'm beginning to understand that," Dr. Nexara admitted. She looked at the 2 human patients. "I apologize for doubting you, and for harming Tai Yang with my stubbornness." "You were following your training," Youngmi said. She had been standing nearby, reviewing charts. "Every species in the galaxy heals one way. We heal differently. It's not your fault that the medical databases were incomplete." Tai Yang was sitting up in his bed, talking with Dai Ho across the gap between their recovery pods. Both humans were in good spirits despite their injuries. They had bonded quickly, sharing stories about their work and joking about their confused alien doctors. "I still can't believe they tried to stop your inflammation," Tai Yang said with a laugh. "That's like trying to stop your heart from beating." "They didn't know," Dai Ho replied. "And honestly, I didn't know enough to explain it properly at first. I just knew something felt wrong." "Trust your gut," Tai Yang said. "Our instincts evolved over millions of years. Sometimes our bodies know better than the doctors." Veltara listened to this conversation with her translator device. The idea that patients might understand their own biology better than trained medical professionals was uncomfortable. But with humans, it seemed to be true. They had an intuitive understanding of how their bodies worked. Later that day, a medical ethics committee arrived from the main station. They wanted to investigate the treatment differences between the two patients. Consul Vranik led the discussion in the medical bay's conference room. "We need to establish clear guidelines," the consul said. His skin had the formal pattern that indicated official business. "The Galactic Medical Council is receiving reports from across the Union. More humans are joining our stations and ships. More are getting injured or sick. We can't have different doctors using different treatments." "The solution is simple," Young Mi said. "Create human-specific medical protocols. Train doctors on human physiology. Stop trying to treat us like any other species." "But that creates inequality," one committee member argued. She was a Quilix with very delicate features. "Every species deserves the same standard of care. If we create separate protocols for humans, what's next? Separate protocols for every species?" "Every species already has different needs," Dr. Thexel pointed out. "My people require water immersion every 6 hours or our skin cracks. Quilix need low-temperature environments. Saurics need high-protein diets. We already customize care. Human-specific protocols are just another customization." The debate continued for hours. Veltara presented her detailed observations of both patients. She showed the timeline of Daeho's recovery with minimal intervention versus Tai Yang's stalled healing under standard treatment. The data was clear and undeniable. Bora added her expertise. She explained the evolutionary pressures that had shaped human immune systems. She talked about Earth's harsh environment, with its extreme temperatures, dangerous predators, and countless pathogens. Humans had evolved to survive conditions that would kill most other species. "Our inflammation isn't a bug," Bora said. "It's a feature. It's what kept our ancestors alive when they had no medicine, no technology, nothing but their own bodies. You can't suppress it without consequences." Young Mi presented case studies from Earth's medical history. She showed examples of human healing from ancient times to the present day. The inflammatory response had been documented for thousands of years. It was fundamental to human survival. Finally, Consul Vranik called for a vote. The Ethics Committee voted unanimously to recommend human-specific medical protocols. The data was too strong to ignore, the evidence too clear. "We'll need someone to write these protocols," the consul said. "Someone who understands both galactic medicine and human physiology." "I volunteer," Veltara said immediately. All eyes turned to her. "I've been studying human medicine intensively. I've observed these patients closely. I want to make sure no other doctor makes the mistakes I made with Daeho." Dr. Thexil's throat sac pulsed with approval. "Veltara would be an excellent choice. She's thorough, careful, and humble enough to learn from mistakes. I recommend we assign her to lead the protocol development." The committee agreed. Veltara felt both honored and nervous. This was a huge responsibility. But it was also important. Humans deserved proper medical care, and she was determined to provide it. Over the next week, Veltara worked with Young Mi and Bora to draft the new protocols. They covered everything from basic first aid to complex surgery. They included detailed explanations of human inflammatory responses, fever management, and scar formation. They added warnings about medications that were safe for other species but dangerous for humans. Meanwhile, both Daeho and Tai Yang continued to heal. Their progress was documented carefully. Medical students came to observe. Researchers took samples. The two humans became minor celebrities on the station. Quan Sik visited regularly, bringing spicy food from the human quarter. Other human workers stopped by to chat. The medical bay's human section became a social gathering place. Veltara found it chaotic at first, but she learned that social connection was another part of human healing. They recovered better with friends around them. One evening, Veltara was reviewing the protocol draft when Daeho called her over to his bed. "I wanted to thank you," he said. "I know you were just doing your job when you gave me that anti-inflammatory medication. You were trying to help. And when you realized it was wrong, you fixed it. That takes courage." Veltara's mandibles clicked softly. "I nearly killed you." "But you didn't," Deho said firmly. "You learned. You changed your approach. You're writing protocols that will help thousands of humans in the future. That's what matters." Tae Yang nodded from his bed. "He's right. Mistakes happen. What separates good doctors from bad ones is what they do after the mistake. You're a good doctor, Veltara." The words touched something in Veltara's thorax. She had been carrying guilt since the incident, but maybe these humans were right. Maybe what mattered was moving forward, not dwelling on the past. "When do we get discharged?" Tae Yang asked. "No offense to the medical bay, but I'm ready to get back to work." Veltara checked their charts. Both humans were healing remarkably well. The inflammation had done its job. New tissue had formed. Bones had strengthened. Scars were forming cleanly. "2 more days," she said. "I want to make sure your healing is complete, and I want to finish documenting your cases for the medical database." 2 more days of hospital food, Deho groaned. "Kwansik better bring extra spicy noodles tomorrow." Veltara clicked her mandibles in what she had learned was amusement. Humans and their spicy food. She still didn't understand the appeal of deliberately inflaming their mouths, but she had learned to accept it as part of their strange biology. The next morning, the finalized protocols were submitted to the Galactic Medical Council. They were approved within hours. Too many doctors had reported confusion about human patients. The need for clear guidelines was urgent. Veltara received a commendation for her work. Dr. Theksil was praised for his willingness to change established practices. Young Mi and Bo-Ra were thanked for their expertise. But the real victory was simpler. 2 human patients were healthy and healing. And the next human who came to the medical bay would receive proper care from the start. No more dangerous mistakes. No more suppressed immune systems. No more fighting against the very thing that made humans so remarkably resilient: their inflammation. 3 weeks after Deho and Tae Yang were discharged, the Galactic Medical Symposium came to the station. It was a major event held every 2 years, bringing together medical professionals from across the Union. This year's theme was New Species Integration and Medical Challenges. Veltara had been invited to present her findings on human inflammatory healing. She was nervous. Public speaking wasn't her strength. But Dr. Theksil encouraged her. Young Mi helped her prepare, and Bo-Ra agreed to co-present, which made everything less frightening. The symposium hall was massive. Hundreds of seats filled with doctors, researchers, and medical students from dozens of species. Veltara stood backstage, her 6 legs trembling slightly. She could hear the current presenter finishing their talk about Quillick's respiratory treatments. "You'll be fine," Young Mi said, placing a hand on Veltara's shoulder. "Just tell them what you observed. Show them the data. Let the evidence speak for itself." Bo-Ra was reviewing her notes. "I've invited Jihai to join us," she said. "She's a human biochemist who specializes in immune system research. Her expertise will add depth to our presentation." Jihai arrived moments later, carrying several data tablets and looking excited. She was younger than young Mai, with bright eyes and an enthusiasm that reminded Veltara of a medical student. "I can't wait to show them the cytokine cascade data," Jihai said. "The molecular details are absolutely fascinating." Before Veltara could respond, a station employee appeared. "You're on in 2 minutes." They walked onto the stage together. The lights were bright. The audience was enormous. Veltara's translator device activated automatically as she began to speak. "Good morning. My name is Veltara. I'm a nurse aboard the hospital ship Velarin's Grace. 3 weeks ago, I nearly killed a patient by trying to save his life." The audience went silent. That was a dramatic opening, but it was true. And it got their attention. Veltara told the story of Daeho's arrival. She explained her initial treatment. She described the inflammation she had observed and her decision to suppress it. She admitted her mistake and explained how Hei-Wan had corrected her understanding. Then she showed the data. Charts and graphs appeared in the air above the stage. The audience could see Daeho's vital signs, his inflammatory markers, his healing timeline. The evidence was clear and compelling. Human inflammation is not a system failure, Veltara concluded. It's a controlled, adaptive response. It's how humans heal. When we suppress it, we harm them. Bo-Ra took over next. She displayed comparative anatomy data showing how human immune systems differed from other species. She explained the evolutionary pressures that had shaped human biology. Humans evolved on a death world, Bo-Ra said. The term made several audience members shift uncomfortably. Earth has extreme temperatures, dangerous predators, and countless pathogens. Humans developed aggressive immune systems to survive. What looks like danger to us is normal for them. Then Ji-Hai stepped forward. She was clearly excited to share her research. "Let me show you the molecular details," she said. The display changed. Now it showed individual cells and chemical molecules. Ji-Hai walked the audience through the inflammatory cascade. Histamines, prostaglandins, cytokines. Each chemical had a specific role. Together, they orchestrated the entire healing process. "This is a human white blood cell attacking bacteria," Ji-Hai said. The display showed microscopic footage, slowed down so everyone could see the details. The white blood cell moved like a predator. It detected the bacteria, it pursued them, it engulfed them and destroyed them from inside. The footage was violent. The white blood cell used chemical weapons, membrane disruption, and enzymatic destruction. Several audience members looked disturbed. One medical student actually stood up and left the hall. The sight of cellular warfare was too much for them. "Our bodies are battlefields," Ji-Hai continued, unbothered by the reaction. "Every injury triggers a war between our immune system and any threats that enter the wound. Our white blood cells are soldiers. Our inflammatory response is how we mobilize them." She showed more footage. White blood cells swarming a wound site. Chemicals being released. Blood vessels dilating. The inflammation looked chaotic, but Ji-Hai explained the order within it. "Every step is controlled," she said. "Our bodies know exactly how much inflammation is needed. Too little, and the wound won't heal. Too much, and we damage healthy tissue. We've evolved precise regulation over millions of years." The presentation continued with more data. Ji-Hai showed studies of human healing across different injury types: burns, cuts, broken bones, internal damage. In every case, inflammation was the first step. In every case, suppressing it delayed or prevented healing. "But there's more," Ji-Hai said. Her excitement was growing. "Humans don't just heal from injuries. We adapt to them. We become stronger." The next display showed muscle tissue repair. When humans exercised intensely, they created micro-tears in their muscles. This triggered inflammation. The body repaired the damage and added extra tissue, making the muscle larger and stronger. "We call this hypertrophy," Ji-Hai explained. "Humans deliberately damage their muscles to make them grow. We inflame them on purpose, for improvement. This is normal human behavior." The audience was murmuring now. The concept was difficult to accept. Self-harm for self-improvement. It seemed contradictory. "We also have immune memory," Ji-Hai continued. "When our bodies fight off an infection, we remember it. If we encounter that pathogen again, we respond faster and stronger. Each battle makes us more resistant to future threats." She displayed data about human vaccination programs. By deliberately exposing humans to weakened pathogens, doctors could trigger immune responses without causing serious illness. The body would develop memory cells, providing protection for years or even decades. "So humans can become immune to diseases?" someone in the audience asked. "To many diseases, yes," Jihai confirmed. Not all, but our adaptive immune system is remarkably effective. We face a threat once, learn from it, and become resistant. This is another reason why suppressing inflammation is dangerous. It interferes with our ability to develop immunity. The presentation moved to its final section. Young Mai returned to the stage to discuss practical applications. We need human-specific medical protocols, she said firmly. The protocols Veltara, Bo-Ra, and I developed are a start, but we need more research, more documentation, more training for medical professionals who will treat human patients. She displayed the new protocol guidelines. They were comprehensive, covering dozens of scenarios. The audience could see how different they were from standard galactic medicine. If a human has inflammation, observe it, Young Mi said. Monitor it. Make sure it stays controlled, but don't suppress it unless it becomes severe. If a human has a fever below 40 degrees Celsius, let it run its course. The fever is helping them heal. If a human's wounds are forming scars, that's normal and healthy. Don't try to prevent it. She paused, looking across the audience. I know this contradicts everything you learned in medical school. I know it feels wrong to watch inflammation and do nothing. But this is how you help humans. By understanding us. By respecting our biology. By letting our bodies do what they evolved to do. The presentation ended. For a moment, there was silence. Then questions erupted from the audience. What about chronic inflammation? Can that harm humans? Yes, Jihai answered. Long-term uncontrolled inflammation can cause problems. But acute inflammation from injuries is different. It's temporary and beneficial. How do you tell the difference between helpful inflammation and dangerous inflammation? Duration and location, Young Mai said. Injury-related inflammation decreases over time as healing progresses. Chronic inflammation persists and spreads. We have diagnostic criteria that can distinguish between them. Are there any circumstances where you would suppress human inflammation? Yes, Veltara answered. Severe allergic reactions, autoimmune conditions, or inflammation that becomes life-threatening. But these are exceptions. Most of the time, human inflammation should be allowed to proceed naturally. More questions followed. Some were skeptical, some were curious, some were from doctors who had already treated human patients and had their own observations to share. In the back of the hall, a human journalist was recording everything. His name was Wu Jin, and he worked for a news service that covered scientific developments. After the presentation, he approached the stage. This is an amazing story, Wu Jin said. The human who heals through inflammation, the alien doctor who learned to understand us. Can I interview you for an article? Veltara agreed, though she was still nervous about publicity. Over the next few days, Wu Jin's article spread across the station network. It was picked up by other news services. Soon, beings across the galaxy were reading about human inflammatory healing. The response was overwhelming. Medical schools requested copies of the new protocols. Hospitals wanted training materials. Research institutions offered funding for more studies. Veltara received dozens of messages. Some thanked her for her work. Some asked questions. Some shared stories of their own experiences treating human patients. One message stood out. It was from the Galactic Medical Council. They wanted to create a new position, Director of Exotic Physiology Studies, and they wanted Veltara to fill it. Exotic physiology? Veltara said to Dr. Thexil. That sounds strange. It means species with unusual biology, Dr. Thexil explained. His throat sac pulsed with amusement. Like humans. You'd be responsible for developing medical protocols for species that don't fit standard patterns. It's a significant promotion. Veltara considered carefully. It was a huge opportunity. But it would mean leaving the hospital ship, leaving her patients, leaving the work she knew. Take some time to think about it, Dr. Thexil suggested. This is a life-changing decision. That night, Veltara couldn't sleep. She reviewed everything that had happened over the past month. One human patient had changed her entire understanding of medicine. had challenged everything she thought she knew, had taught her that sometimes the best treatment was to step back and trust the patient's biology. She thought about all the humans joining the Galactic Union. They would need doctors who understood them. They would need medical care designed for their unique physiology. Maybe this was her purpose. Maybe this was where she was meant to be. By morning, she had made her decision. 3 months had passed since the symposium. Veltara stood in her new office, looking out at the busy medical research station. She had accepted the position as Director of Exotic Physiology Studies. The work was challenging but rewarding. Every day brought new questions about species with unusual biology. But humans remained her primary focus. They were still the most different species in the Galactic Union, and their numbers were growing. Her computer terminal chimed, an incoming message from the hospital ship. Veltara opened it and smiled with her mandibles. It was from Dr. Thexiel. Deho returned for a checkup today, fully healed, no complications. He asked about you. I told him about your promotion. He said congratulations and that he always knew you were special. Also, he brought more spicy noodles and scandalized the new nurses. Veltara clicked in amusement. Some things never changed. Another message arrived. This one was from Commander Zix at the station security office. We need your expertise. Human security officer injured during training. Medical team uncertain about treatment. Can you consult? This was becoming common. Veltara had become the go-to expert for human medical questions across the sector. She grabbed her data tablet and headed to the security medical bay. When she arrived, she found a young human male on an examination table. His name was Hyunwoo. He had twisted his ankle during combat drills. The medical staff had scanned it and were now standing around looking confused. The joint is inflamed, the attending physician explained, but he says it doesn't need treatment. We wanted your opinion. Veltara examined the scans. The ankle was swollen. Blood flow to the area was elevated. All the classic signs of inflammation. But the bone wasn't broken. The ligaments were strained but not torn. This is normal acute inflammation from soft tissue injury, Veltara said. His body is already healing it. Keep the ankle elevated. Apply cold to reduce swelling if he's uncomfortable. But no anti-inflammatory medication unless the pain is severe. That's what I told them, Hyunwoo said, but they wanted to put me in a healing pod for 3 days. Not necessary, Veltara assured him. Rest for a day or two. Light activity after that. You'll be fine. The medical staff looked uncertain, but accepted her judgment. Veltara was the expert now. Her recommendations were protocol. As she left the security medical bay, Veltara reflected on how much had changed. 3 months ago, she would have rushed to suppress that inflammation. She would have seen it as a threat. Now she recognized it as healing in progress. The Galactic Medical Council had officially updated their databases. Human medical information was now complete and detailed. Every hospital, every medical bay, every first aid station had access to proper treatment protocols. Veltara had personally trained over 200 medical professionals. Some were stationed on human-majority ships. Others worked at ports where human traders frequently visited. All of them had learned the same lesson she had. Human biology was different. And different didn't mean wrong. That afternoon, Veltara received an unexpected visitor. Captain So-Jin walked into her office with confident steps. She was the captain of a cargo vessel called Soul's Pride. Her crew was entirely human, except for a few alien specialists. I have a job offer, Captain So-Jin said without preamble. I need a ship's medic. Someone who understands human medicine. Someone who can also treat the non-human crew members. Your name keeps coming up. Veltara was surprised. I just accepted this position 3 months ago. I know, Captain So-Jin said. But think about it. Right now you're consulting, giving advice, training others. That's valuable work. But wouldn't you rather be practicing medicine directly? Working with patients again? Veltara thought about her days on the hospital ship. She did miss direct patient care. Research and training were important, but they weren't the same as actually treating injuries and illnesses. "What kind of medical cases would I see?" Veltara asked. "Everything," Captain Sojin said with a grin. "We do cargo runs through contested space. Pirates sometimes attack, equipment fails, people get hurt. You'd need to handle trauma, illness, routine care, everything. It would be challenging. And dangerous? Sometimes. But you'd have full medical authority. My crew would follow your protocols. And you'd learn more about human medicine in 6 months on my ship than in 6 years of research." Veltara considered carefully. It was tempting. Very tempting. But she had responsibilities here. "I need time to think about it," she said. Captain Sojin nodded. "Fair enough. We're in port for another week. Let me know before we leave." After the captain departed, Veltara contacted Dr. Thexil. She explained the offer and her uncertainty. "You should take it," Dr. Thexil said immediately. "You've done excellent work here. You've established the protocols, you've trained the first wave of specialists, but you're a practicing nurse, not a career administrator. Go back to what you love." "But the research station needs me." "The research station will be fine. We'll find another director, but Soul's Pride needs someone with your specific expertise. Someone who understands humans at a deep level. Someone who has learned from direct experience, not just textbooks." Veltara knew he was right. She had always been happiest working directly with patients. The administrative work was necessary, but it wasn't her calling. She contacted Captain Sojin that same day. "I accept your offer." The week passed quickly. Veltara transferred her responsibilities to a qualified replacement. She packed her belongings. She said goodbye to colleagues who had become friends. On her last day, young Mi and Bora took her to the station's human quarter for a meal. They went to a small restaurant that served spicy food. Veltara had learned to tolerate the smell, though she still didn't understand the appeal. "You've come a long way," young Mi said. "Remember when you thought inflammation was deadly?" "I remember trying to save Daeho by nearly killing him," Veltara replied. "That's not a memory I'll forget." "But you learned," Bora said. "You changed your mind when presented with evidence. You admitted your mistakes. You did the hard work of understanding a completely different biology. That's rare. Most beings just stick with what they know." "I had good teachers," Veltara said, "and patient subjects. Daeho could have been angry with me. Instead, he helped me learn." "That's very human," young Mi said with a smile. "We're good at adapting to new situations. At finding common ground with people different from us. Maybe that's why we fit into the Galactic Union despite our weird biology." The next morning, Veltara boarded Soul's Pride. The ship was larger than she expected. The cargo holds were massive, the crew quarters were comfortable, and the medical bay was well equipped with both standard and human-specific supplies. Captain Sojin gave her a tour. "We have 42 crew members, 39 humans, 2 Quilix engineers, and 1 Saurix navigator. You'll mostly be treating humans, but the other species need care too." "I can handle that," Veltara said confidently. The first week was an adjustment. Living on a cargo ship was different from working on a hospital vessel. The crew was informal and friendly. They called Veltara by her name instead of using titles. They invited her to meals and social gatherings. She treated her first case 3 days into the voyage. A cargo handler named Min Seok had caught his hand in a loading mechanism. 2 fingers were badly bruised. Veltara examined the injury carefully. "Significant soft tissue damage," she said, "but no fractures. The inflammation will be substantial." "Yeah, my hand's gonna swell up like crazy," Min Seok agreed. "I've done this before." Veltara cleaned the injury and bandaged the fingers. She gave Min-seok ice packs and instructions to keep his hand elevated. No anti-inflammatory medication. No suppression of his immune response. Just support for his body's natural healing. 2 weeks later, Min-seok's hand was completely healed. The inflammation had done its job. The bruises had faded, the damaged tissue had repaired itself. Simple and effective. Other cases followed. A cook burned herself on a hot surface. A mechanic sprained her wrist. An engineer developed a respiratory infection. Veltara treated each case according to human-specific protocols, and each patient recovered quickly and completely. The Quilix engineers required different care. Their delicate tissue needed gentle handling. Their temperature regulation was sensitive, but Veltara had learned flexibility. She could adapt her approach to each patient's needs. 1 month into the voyage, pirates attacked the ship. The battle was brief but intense. 2 crew members were injured. One had a deep cut across her shoulder. The other had broken ribs from being thrown against a wall during an explosion. Veltara worked quickly and calmly. She had trained for this. The shoulder wound was bleeding heavily, but the cut was clean. She applied pressure to stop the bleeding, then carefully cleaned and closed the wound. Inflammation would follow, but that was good. It meant healing was beginning. The broken ribs were more concerning. The crew member's name was Yoon-ji. She was in significant pain. Veltara scanned the injury carefully. 3 ribs were fractured. One had a displaced fragment that could potentially puncture the lung. This required surgery. Veltara prepared the medical bay's surgical suite. She had assisted in surgeries before, but this was the first time she was operating independently. Captain So-jin stood by to help if needed. The surgery went well. Veltara carefully repositioned the bone fragment and stabilized it. She repaired minor internal damage. She closed the incision cleanly. Throughout the procedure, she monitored Yoon-ji's vital signs carefully. When Yoon-ji woke up, she was groggy but stable. "How bad is it?" she asked. 3 broken ribs, Veltara said. "I had to perform surgery to repair one of them. The others will heal on their own." "How long until I'm back to work?" "Several weeks for full recovery, but you can do light duty in a few days, once the initial inflammation decreases." Yoon-ji nodded. "Thanks, Doc." Over the following days, Veltara watched Yoon-ji heal. The inflammation around the surgical site was significant but controlled. The broken ribs were forming new bone. The incision was closing cleanly. Everything was progressing exactly as human healing should. Captain So-jin visited the medical bay frequently. "You did well," she told Veltara. "Cool under pressure. Confident in your skills. That's what we need on this ship." Veltara felt proud. This was what she was meant to do. Not sitting in an office writing protocols, not training other doctors, but actually treating patients, making a direct difference in their lives. 3 months into her assignment, Veltara was reviewing her medical logs. She had treated over 60 cases, minor injuries, illnesses, a few emergencies. Every patient had recovered. No complications, no mistakes. She thought about her journey. From the nurse who had nearly killed Dae-ho to the ship's medic who confidently treated human injuries. She had learned so much, not just about human biology, but about herself. That evening, she sat in her quarters and wrote in her personal log. It was a habit she had started after the incident with Dae-ho. A way to process her thoughts and document her experiences. Today marks 3 months aboard Soul's Pride. I have treated more humans in this time than in my entire previous career. Each case has taught me something new, not just about their biology, but about their spirit. Humans are warriors, not in the military sense, though many serve in that capacity. They are warriors against injury itself. Every cell in their body is a soldier. Every wound is a battlefield. When they get hurt, they don't give up. They don't wait passively for help. Their bodies immediately mobilize for battle. The inflammation I once feared is their greatest weapon. It brings resources to the wound. It attacks invaders. It clears debris. It rebuilds what was destroyed. And it does all of this automatically, without conscious thought. I once thought inflammation was chaos. Now I see it as beautiful efficiency. Every chemical released has a purpose. Every cell that responds has a role. It's a symphony of biological warfare, perfectly orchestrated. Humans fracture bones, and those bones heal stronger than before. They tear muscles, and those muscles rebuild larger. They face diseases and develop immunity. They adapt. They overcome. They survive. I am honored to serve as their medic. I am privileged to witness their resilience, and I am grateful to have learned this lesson. Sometimes the best medicine is to trust the patient, to understand their biology, to let their bodies do what evolution designed them to do. Humans don't heal despite inflammation. They heal through it, through controlled warfare at the cellular level, through the very thing I was trained to prevent. I understand now, and I will never forget. Veltara closed her log and looked around her quarters. The ship was her home now. The crew was her family, and the humans she treated were her teachers. She had come a long way from that frightened nurse who didn't know how to help a cargo pilot with inflamed wounds. She had grown. She had learned. She had become something better. And she was exactly where she was meant to be.